Sprains in the lower back are one of the most common causes of back pain, and almost everyone experiences pain in similar areas throughout their lives. Ligament injury refers to sprains of the lumbar spine, while damage to tendons or muscles refers to stretching and is related. Most often, lumbar sprains and sprains of the lumbar muscles occur as a result of actions such as sudden bending, twisting, or other intense movements. These movements cause severe pressure on the ligaments or muscles of the lower back. Before watching the video, like the video, press a subscribe button and turn on the bell so that as soon as a new video is released, you will be the first to visit the video. Cause of lumbar sprains, strains in the lumbar region. There are two types of sprains in the upper and lower back. The reasons for this are: causes of lumbar sprains in the lower back, stretching of the lower back, sudden rotation or stretching of a muscle or tendon in the lower back, for example, stretching during exercise, excessive use or prolonged use of the lower back muscles, carrying heavy objects every day, getting in the wrong position when lifting equipment or putting too much pressure on the back muscles when lifting heavy equipment, during daily activities, accidents that cause injuries to the spine and other lumbar structures such as overweight, excessive curvature of the lower back, and weak back or abdominal muscles can also lead to lower back strain. Causes of sprains, strains in the upper lumbar region and bad posture, such as drooping neck and shoulders. Frequent movements, such as lifting, twisting, and bending. The spine has become vein strain. Symptoms of sprains in the upper and lower back include: symptoms of sprains or strains in the lower back. Severe, excruciating pain in the lower back that gets worse with movement. Lower back pain that may even spread to the lower buttocks. Spasms and muscle cramps in the lower back. Swelling in the injured area, loss of strength and ability in the muscles of the lower back, problems walking, bending forward or sideways, and standing straight. Stretch marks in the lower back and the middle of the lower back, which may restrict neck movements. Exacerbated by deep breathing, coughing, spinal rotation, or prolonged standing. Muscle spasms in the upper back and neck and stiffness in the lower back. Reduction of range of motion in the lower back, neck, and shoulders. Lumbar vein. The following steps are performed by a doctor to diagnose lumbar sprains. Medical history and physical examination. A slight vein or strain in the lower back is usually diagnosed based on your medical history and physical examination. Your doctor may review your medical history and ask questions such as details of events or your habits and lifestyle. Ask if it may be due to sprains or strains in your lower back. Your doctor may also do a physical exam to look for stiffness or swelling in your lower back. Studies by imaging methods. The following tests are recommended if the pain persists for more than 2 weeks and causes weakness or loss of function. X-ray. X-rays of the spine may be used to rule out bone fractures, tumors, or infections as a cause of pain. MRI. MRI scans use a magnetic field and radio waves to create precision of the spine. If there is a spinal cord or ligament injury that is causing the pain, an MRI scan can detect it. Computed tomography, CT, scan. A CT scan can detect bone abnormalities that may cause pain in the lower back. Treatment for sprains or lumbar sprains. The main purpose of treating sprains or strains in the lower back is to reduce pain and improve mobility if the range of motion is limited. Other treatments include bed rest, hot and cold compresses, pain relievers, exercise, and finally surgery in severe cases. Rest on the bed. The first step in treating sprains or back strains and reducing muscle spasms is rest. It is usually recommended to rest in bed immediately after the injury. This helps reduce the symptoms of low back pain. However, prolonged rest, more than 48 hours, in the early phase of pain may cause muscle weakness, leading to increased levels of long-term disability. Therefore, patients are advised to return to normal activities after 48 hours of rest. Treatment with hot and cold compresses. Cold compress treatment involves the use of ice packs and compresses or compresses. This treatment is recommended for the first 70 to 48 hours after the injury and is performed for 15 to 30 minutes to apply anesthesia or numbness in the desired area. Cold compress treatment reduces swelling and pain in humans. On the other hand, hot compress treatment should be started 48 to 72 hours after injury. Hot treatment includes hot water packages and hot baths. Warm compresses help relax muscles and reduce severe pain and stiffness. Medicines. Medications that are mainly used to treat sprains or sprains include medications such as painkillers and muscle relaxants. Analgesics. Medications used to reduce pain. Paracetamol. Paracetamol is an important analgesic or non-opioid analgesic. It reduces pain and fever, but has no specific anti-inflammatory effect. Paracetamol is usually recommended for painful muscle spasms or lumbar sprains. Anti-inflammatory drugs, aspirin and other related compounds are a class of drugs known as non-steroidal anti-inflammatory drugs, NSAIDs. These drugs reduce pain and symptoms of inflammation such as fever, swelling and redness. Some non-steroidal anti-inflammatory drugs, NSAIDs, are available over the counter. Non-steroidal anti-inflammatory drugs, NSAIDs. NSAIDs are used in a variety of musculoskeletal pain syndromes, including low back pain, low back muscle pressure, muscle injuries, pelvic floor tension, neck pain, etc. Muscle sedatives. Medications such as metaxalone, metoprolol, or phenadrine are prescribed to reduce back pain caused by lumbar muscle strain. Most pain relief from these medications occurs within the first 7 to 14 days, but their benefits may last up to 4 weeks. Side effects of these drugs include drowsiness, seizures, and cardiac effects. Physical medicine. At your first appointment, your physical therapist will assess your condition and design a customized treatment plan depending on the cause of the injury, its severity, and your general health. In the first phase of treatment, e.g. acute phase, our physical therapist will focus on reducing swelling, pain and muscle spasm using the following treatments. Electrical stimulation. Electrical stimulation, or neuromuscular stimulation, NMES, is a technique that uses electrical waves to create muscle contraction. The electrodes, controlled by a unit, are placed on the skin in a predetermined area. Electric current is then sent from the unit to the electrodes and transmitted to the muscle, leading to contraction. Soft tissue massage. Soft tissue massage with the method of kneading, stroking, rubbing, which is done gently on stiff muscles. This massage is done to help relax the muscles. After a few minutes, you can expect to feel good and be able to move more naturally. Ultrasound. Ultrasound is a treatment that is commonly used in physical therapy. This method is used for deep heating in the soft tissues of the body. These tissues include muscles, tendons, joints, and ligaments. Ultrasound therapy in physical therapy should not be confused with diagnostic ultrasound, which is a type of ultrasound used to see inside the body, such as examining a fetus during pregnancy. There is a small crystal inside your PT ultrasound unit. When an electric charge is applied to this crystal, it vibrates rapidly, generating piezoelectric waves. These waves are emitted from the ultrasound sound front as ultrasonic waves. The ultrasound wave then enters your damaged tissues while using this treatment. This increases blood flow and activates the blood, which leads to the theoretical benefits of treatment. Muscle retraining, muscle energy technique. The muscle energy technique, MET, is a manual therapy that uses the muscle's own energy to form gentle isometric contractions to relax the muscles. This state of muscle relaxation occurs through spontaneous or reciprocal inhibition or lengthening of the muscle. Compared to static traction, which is a passive technique in which the therapist does all the work, the MET muscle energy technique is an active method in which the patient is actively involved. The MET muscle energy technique is based on the concepts of spontaneous inhibition and reciprocal inhibition. If a submaximal contraction of a muscle is followed by traction of the same muscle, it is known as spontaneous inhibition of the MET muscle energy technique, and if a submaximal contraction of a muscle is followed by contraction of the opposite muscle, it is known as the MET muscle energy technique. Exercises. In the second phase of treatment, physical therapists begin to combine the following fitness exercises and treatment activities into a treatment plan to improve and restore performance. Stretching exercises, positioning exercises. Strength training is a wide range of movement exercises. Stretching can help stretch your waist in many ways. Although stretching can sometimes be overlooked, if you pull a muscle in your back, it can be the key to your recovery process. Stretching helps improve flexibility, improve physical performance, increase your endurance, reduce the risk of injury, and increase blood flow. Stretch the knee towards the chest. Lie on your back with your toes facing the sky while lying on your back. Gently bend your left knee and bring your foot closer to your chest and pull. Wrap your arms around your thighs or knees and pull them toward your chest. Hold this position for 10 seconds, then repeat with the other leg. 2 knees toward the chest. Lie on the floor from the waist, bend your knees and place the soles of your feet on the floor. Then, slowly raise both knees and pull toward your chest. Hold the knees with your hands. Then raise the knees and place them near the chest, staying in this position for 10 seconds, then repeat. Thigh joints strain. Take one step back with your right foot while standing on your feet with your feet shoulder width apart. Bend your left knee and shift your weight onto your right hip joint while keeping your right leg at a 90-degree angle, leaning forward more and lowering your right leg down to a point. You can feel the external tension of your buttock muscle and then repeat with the other leg. Cat-cow pull mode. Begin this movement by kneeling on all fours. Keep your arms at your sides and under your shoulders, and your knees at your hips. Then, as you exhale deeply, gently arch your spine. As you do the tail, pull the center of your body toward your back, like a cat. Do this movement about 10 times. Surgery. Surgery may be seen in severe cases when there is a ruptured ligament or muscle fiber. Methods to prevent sprains and sprains. To prevent sprains and sprains, you should follow some lifestyle tips as follows. When lifting a heavy object, stand close to the object and bend at the knees and keep your back straight. When moving after lifting a heavy object, use your legs to rotate and do not rotate your back. Avoid sudden turns and movements while exercising or even during daily activities. Avoid resting in bed for more than 48 hours. Prolonged rest can weaken the important muscle group that supports your back, and keep it steady. Do physical exercises such as crunch exercises or strengthen abdominal muscles to have more spinal stability. You can also consider exercises such as swimming, cycling and brisk walking that put more stress on your back. Avoid sleeping on your stomach because in this position your back is curved, which can aggravate the pain in your neck or back. When driving, place the seat near the steering wheel to maintain the natural curves of your body. If you have to sit in one place for a long time, be sure to get up and stand at short distances. Always maintain the correct position of your body while standing or sitting. Keep your body weight at a normal level. Excess weight can put pressure on your spine and back muscles. If you like this style of video, then subscribe and support me with your likes and comments.